Now to the United States. President Trump has declared a national emergency and offered individual states billions of dollars in support to cope with the impact of this virus. As he spoke, stock markets began to surge after days of sharp declines. Public life in the United States, though, is slowly grinding to a halt. Abigail Beeman reports.
The action I am taking will open up access to up to $50 billion.
President Donald Trump declaring a national emergency in an effort to contain the virus. But as he promised more tests, he downplayed the gravity of the need.
5 million within a month. I doubt we'll need anywhere near that. We don't want people to take a test if we feel that they shouldn't be doing it.
Trump shook hands and touched people at the announcement. He promised more drive-through testing sites. Today, New York State opened its first in New Rochelle, the hard-hit area under containment.
There are 6 lanes that are operating. You drive in your car, and the medical staff comes to you, does the test, takes the swabs.
Testing is still not where it should be in the U.S., admits one of the country's top doctors.
What we really need is to get the test available in venues that people could easily access. It is very likely we will have that within the next week or so.
We will let people in groups. Please be patient.
Long lines at this New York grocery store with empty shelves, a regular sight. One example of how daily life in America is changing.
We're trying to stay calm.
Several states are shutting down all schools.
I don't have the option just to take time off, so here they are.
Meanwhile, lawmakers have been debating a bill to provide aid, including expanding paid sick days.
The 3 most important parts of this bill are testing, testing, testing. This legislation facilitates free coronavirus testing for everyone who needs a test.
But its future remains uncertain, with the president saying what the House Democrats proposed wasn't enough. Abigail Beeman, Global News, Washington.
Experts are looking at Europe to predict what's coming here in a matter of weeks, and it's not good. Today, the WHO declared Europe is the epicenter of this pandemic. Italy, which had its first outbreak on February 23rd, is now overwhelmed with more than 15,000 cases, and over 1,000 people have died. That all happened in just 20 days. Outbreaks in Spain, Germany, and France are also growing exponentially. Just 1 week ago, those countries were each reporting a few hundred cases. Now there are more than 4,300 in Spain, 3,100 cases in Germany, and more than 2,800 in France. Doctors in Ireland are warning that country is 14 days behind Italy. The worry is that if the spread isn't slowed down through things like shutting down travel and public events, healthcare systems across Europe will be overwhelmed. Crystal Gamansing on the new epicenter of this pandemic.
A state of emergency takes effect Saturday in Spain after a surge of infections. In Europe, it is the second to Italy for COVID-19 cases. Spanish officials warn the infection rate could more than double to 10,000 by next week. The Czech Republic also declaring a state of emergency. It is closing its borders to travelers crossing from Germany and Austria. Austria is following Italy, closing all shops except grocery stores, pharmacies, and banks beginning Monday. Germany, meanwhile, is reassuring people with an economic pledge, €500 billion to support Europe's largest economy. In France, public gatherings are limited to 100 people. The Louvre, Eiffel Tower, and several other historic attractions are closed. The Queen canceled 2 upcoming public appearances. Buckingham Palace says other events will be reviewed on an ongoing basis. Crystal Gamansing, Global News, London.
We left the good news for last. And yes, there is some good news about this virus. The vast majority of people who get COVID-19 have mild symptoms and recover from it. In fact, roughly half of the 137,000 people who have caught this virus worldwide, that includes tens of thousands of people in China where it started, have recovered. Eric Sorensen shares some optimistic news during a dark time.
It is a look of modern desolation. Empty arenas, political chambers, airports, images of society in retreat. An empty feeling has swept the world more quickly than COVID-19. The stock markets, the instant pulse of the economy. From big gains to bigger losses symbolizes the swings between hope and despair. It's easy to find reason for pessimism. 3,000 deaths in China alone from an especially efficient virus. And Italy demonstrates that a modern nation with impressive health care could not keep up. And the numbers are climbing daily. Our closest neighbor may well have responded way later than it should have.
Anybody that wants a test can get a test.
And in this country, lineups for basic food is a shocking sight. But consider reasons for optimism, even at a time like this. In China, the first wave of this pandemic appears to be receding. Chinese mobilization to build hospitals was remarkable. South Korea, where cases spiked sharply, aggressive measures like 10,000 tests per day has limited the number of deaths. In Africa, an impoverished continent recently saw its first cases, but a warmer climate may be more resistant to this virus, and Africans have exceptional experience dealing with deadly diseases. Children appear to have greater immunity. That is wonderful news. And for the elderly and vulnerable, this nation's sense of calm and concern has been a hallmark of Canada's response. And while social distancing will buy us time, Toronto's Sunnybrook Research Institute and 2 universities have isolated the COVID-19 virus, the first step towards better treatment and a vaccine. In the meantime, there is human spirit. In hard-hit Italy, serving coffee with imagination. And on a deserted street, a serenade from one apartment to the neighbors. There is reason to be pessimistic and optimistic, but we can bridge the two by being realistic. And, like Gloria Gaynor, doing what each of us can to survive. Eric Sorensen, Global News, Toronto.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.